So much for that, and thank you everyone for being here today. I wish I could see you all face to face and in person, but I feel everyone's energy here today. So thank you so much for being here. So this presentation is called Harm Reduction Approach to Care, a practical model to help meet people who are pregnant. And I added, and ourselves, where they're at. So my name is Julie Falchuk. I'm a licensed clinical social worker. I'm a licensed chemical dependency counselor, and I'm a registered yoga teacher as well. I currently work in a private practice setting, and I see people who, I work with individuals, I work with couples, and I also lead groups for people who are either struggling with substance use or maybe who are in recovery from substance use as well. So I'm really glad to be here today. All right, so before we begin, I just wanted to acknowledge the land that I'm on today. So I honor that I occupy the unceded lands of the Jumanos, the Tonkawa, the Lipan Apache, the Coahuitican, and the Comanche peoples, also known as Austin, Texas. Okay, so today we're going to be learning a bit about harm reduction. We're also going to be exploring our own implicit bias and stigma that we might have and that we might hold around people who use substances, people who are pregnant. We'll also explore engagement strategies to work with people who are pregnant, and also engagement strategies to work with ourselves while working with people who are using substances. And then identify ways to meet others and ourselves. So others where they're at and ourselves where we're at. Now, I purposefully am using the term people who are pregnant to acknowledge that not everybody who is pregnant might identify as female or a woman. So I just want to let you all know that that's why I'm using that language today. Okay. So what is harm reduction? Now, I want to acknowledge that there may be some folks on this call who might be very familiar with harm reduction. You may have been someone who has benefited from the harm reduction model. So I just want to acknowledge that people might be at very different places in terms of understanding harm reduction. And so just acknowledging that to begin with. So just so we're on the same page, so what is harm reduction? Harm reduction is a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. Harm reduction is also a movement for social justice built on a belief in and respect for the rights of people who use drugs. So when we talk about a harm reduction approach, essentially what we're talking about is supporting people wherever they're at along the continuum of drug use to support them in reducing negative consequences that they may have associated with their substance use. Again, it's also a movement for social justice. So it believes that people come first. We respect the rights of people who use drugs. We respect them as human beings. And we acknowledge that there are many strengths for people who use substances, and they're, at the end of the day, just human beings. So harm reduction is really, the way that I like to think about it too, is that it's a non-judgmental approach to working with any person that you're working with. And we use harm reduction pretty much every day, right? If we drive, we put on our seatbelts. That is one way that that we use harm reduction, right? Because driving in cars inherently could cause danger, could cause us to get hurt. And so in order to reduce the risk of being hurt, we put on our seatbelts. So it's actually not just specifically related to substance use. Okay, so here are the principles of harm reduction. So harm reduction allows us to understand that drug use exists on a continuum, including abstinence. So there are many ideas or beliefs that that harm reduction does not include abstinence, but in fact it does. Abstinence is the safest way, right, to prevent harm to ourselves. And so, sure, abstinence is like the greatest way of harm reduction, but we also need to understand that that's not the reality for many people. It's not the reality for some people who are pregnant and using substances. So we have to understand that drug use exists on a continuum between, mild use, occasional use, moderate use. We also want to accept with harm reduction that drug use is part of our world, right? Drug use is part of our world. It's not going away anytime soon. Rather, we want to minimize the effects, the negative effects that somebody might be experiencing. Harm reduction also, it establishes quality of life as the criteria for useful interventions, not necessarily the cessation of drug use. So when we're working with somebody who is maybe pregnant and using substances, or somebody who is using substances, the idea is to establish what quality of life looks like for the person, as a way to move towards and engage in interventions, rather than assuming that stopping drug use is the only way to create positive change. Like I said earlier, harm reduction uses a non-judgmental and empowerment approach to care. It's also user-driven. So the harm reduction movements really are based on people who are substance users, people who are in recovery, people who are in the community. So it's user-driven rather than kind of coming from a top-down model. It comes from more of a community engagement and community empowerment model. Harm reduction also uses the principle that harm cannot be assumed, right? So just because someone is using substances, we can't just assume that that there's negative consequences to their use, or that it's problematic. Harm reduction also helps us understand the impact of isms and vulnerability with drug-related harm. Right? So it helps us understand the impact of racism, homophobia, sexism, right? All of the isms that that impact people who use substances. And it also does not minimize the real dangers of substance use, right? And that's often a misconception that I've heard from folks, is that, harm reduction just supports drug users or drug use. Harm reduction also understands that there are real dangers to using substances as well. Okay. So some of the goals, and I understand that folks here might be doctors, nurses, social workers, peer counselors, peer educators, outreach workers. So this information that I'm sharing today, hopefully in your work, in whatever role that you do, that hopefully you can take something from this and use it with the people that you work with. So some of the goals, if we're talking about harm reduction counseling, harm reduction counseling can very often be a low threshold type of counseling. And what I mean by low threshold, it's really about meeting people where they're at, right? So harm reduction counseling can include simply just being there for another human being, right? Being someone who can listen and provide a safe space. Additionally, right, some of the goals include moving clients to a more secure footing in life, helping to resolve problems and encourage better health and functioning. We want to reduce negative outcomes and avoid risky situations, right? And any change is seen as progress, right? So the smallest of change that you or I might see as very minimal potentially, or, you know, not quote big enough or progressive enough, any change we want to acknowledge as progress. We also want to assume that clients have strengths that can be supported. So an example of this in working with clients who are actively using substances, people who are pregnant who are actively using substances, something that I always like to kind of share or even just highlight is so many of the folks I work with have skills in communication, in engaging with people, in marketing skills, right? In understanding how to connect to people, right? And so we really want to kind of acknowledge that there's skills that people use who are using substances that they can then transfer into their lives. All right, so I just want us to take a moment, and if you'd like, you're welcome to close your eyes or just allow your eyes to be soft. And I'm going to read each of these statements as a way for us to just begin to explore maybe some of our own internal bias, maybe some of our own stigma that we have around substance use and people who are pregnant. Now, as you go into this, I really want to encourage you to get curious about what's showing up for you, to find compassion towards yourself as you're listening to these statements, and to practice non-judgment towards yourself as well. So again, if you'd like, you can just close your eyes and listen. So the first statement, I understand the experience of stigma and bias for a person who is pregnant and also using substances. I trust a person who uses drugs and is pregnant just as much as I trust people who are pregnant who are not using drugs. If a person is pregnant, it is their responsibility to stop taking drugs. I know how to avoid language that stigmatizes people who are pregnant and actively using substances. Although it is hard to admit, I sometimes judge people who are pregnant who cannot stop using drugs. If a child is born addicted to drugs, that is child abuse. So just take a moment, and if you're comfortable, I welcome you to just put in the chat anything that you noticed that came up, whether it was a body sensation, whether it was your heart racing, whether your palms started to sweat, anything that you noticed, an emotion that came up, a thought, a physical sensation. If you're open to it, I welcome you to just put it in the chat. And I believe if you want to just send it to me as well, you're welcome to do that too. When I've done this before, what some people have noticed is their heart started to race a little bit. Their eyebrows went up. Their palms started to sweat a little bit. People also noticed that they had no reaction to any of these prompts. So sadness, a lump in my throat, racing heart. Yeah, thank you for sharing that. Yeah, there is, I'm glad that you mentioned sadness. I can connect to that as well. I noticed my chest getting tight, I did feel some judgment, and then I got sad about the heaviness of the impact of horrible drug policy and how it impacts the most vulnerable. Absolutely. Yes. Yeah, drug policy absolutely impacts the most vulnerable. And I'm, it's helpful to notice that there's a sadness, right? Or even first judgment, and then checking in what might be underneath the judgment, right? Which I see some people saying sadness as well. Yeah, okay. Okay. So, yeah. Okay, so someone just said, I'm a woman who's in recovery and used drugs when I was pregnant. For me, I felt empowered that this is the topic. I'm so glad to hear that, and thank you for sharing that. Yeah, that's one of the goals in this presentation is to help the people we work with, and hopefully, if this is something that you experience yourself, that there's some empowerment that you might feel too here. So this next slide talks about implicit bias. There's a test, I don't know if anyone has done it before. It's through Harvard, and I have the link here down below, just exploring implicit bias. The tests are really eye-opening and very interesting. However, there isn't a test on implicit bias related to substance use. So I think that's interesting, and hopefully one day they'll have that so that we can bring more awareness to our own implicit bias. And when we talk about working through implicit bias and through our own bias, some ways that we can do that and work through it is just to simply acknowledge our own beliefs, right? Just simply acknowledging our own beliefs. Again, without judgment, but to just get curious about it. To acknowledge that community matters, right? And what I mean by that is connecting with people who can have conversation with you about stigma, or about judgment, or about our own biases. And hopefully there's spaces in your lives, if you don't have it now, that there are folks that you can find to connect with, and just really kind of get to know our own biases. We all have them in varying degrees. And then committing to change, right? So if we can commit to our own desire for change, our own willingness to change, our own willingness to know that it's okay to have these judgments, to have these biases, if we can just acknowledge them. I know for me, that has been some of the most powerful work for me, is to just begin by admitting, acknowledging, and then committing to do the work. Okay. So the impact of stigma and language can be devastating for people who are actively using substances, for people who are pregnant that are using substances. Language can be so powerful. So I wrote a few things here to hopefully get us to think about language, or to get curious about our language and how we use it. So the terms junkie or addict, now the caveat here is if somebody identifies themselves as an addict, as often occurs in the AA community, it's not a bad thing, it's not a wrong thing, right? What I tend to be very mindful of is when somebody that I'm working with or speaking to identifies as an addict, I often like to ask them, is that the term that that you've labeled yourself as? Is that something that you connect to, or is that something that somebody else labeled for you? And so that can kind of help clarify if this is a helpful term, because it can be for people, versus labeling someone before they've identified it for themselves. So an alternative that we can use when we're not sure if someone is labeling themselves as an addict is a person who uses substances, or a person who uses drugs. The other term, clean, right? So clean might seem harmless, but when we think about the term clean, we then think about what the opposite of clean is, which is dirty, right? So again, if someone identifies themselves as, oh, I've been clean for 10 years, right? Great. Tell me, does that term something that you came up with for yourself? Is that a term that somebody gave to you? How does that feel for you to identify as clean? And so we want to be mindful that the opposite of clean can be dirty. And of course, people who use substances, people who are pregnant that use substances are not dirty. So an alternative to that is someone who no longer uses substances, or sometimes folks will say that they're a person in long-term recovery. So that can feel a little bit less stigmatizing, a little bit more welcoming. And then the term born addicted, an alternative to that could be a baby with prenatal exposure, right? Because we don't necessarily know if they were born addicted or kind of what the situation is, but rather we can use the term a baby who had prenatal exposure. And again, that can feel less stigmatizing to the parent or the person that was carrying the baby. So just some additional terms to consider. Slips rather than relapse. Again, some people will say, that they relapse, and what I have found, and I think what folks have, when they talk about relapse, there's this idea that they're going back to the beginning, right? They're going back to the beginning, and what I often like to tell people is like, no, you're not going back to the beginning. You have had so much time and so much space to learn and to grow and explore yourself and your experience, that this may have just been a slip. This may have just been a slip, and we can continue on, and we can learn from what happened, and we can understand what led to this, right? But relapse can often, for many people, has the connotation that they have to start again. And then positive, negative versus pass, fail. So this is in relation to drug testing, right? And so often we say pass or fail, which makes sense, right? Did you pass your drug screen? Did you fail your drug screen? But taking a moment to pause and consider, if I fail a test, it doesn't feel good. It doesn't feel good to fail at something. Right. And so if we use the terms, was it a positive drug screen or was it a negative drug screen? Again, that's just one way to take away some of that stigma, around the result if someone is taking a drug screen. And we also know that stigma continues to keep people away from accessing care, right? So stigma is one way that that leads to people not accessing care. And so if there's any space for us, and it might seem like a small change, right, to explore language as a way to let people know that they are welcome here, that they will not be stigmatized. Hopefully we can increase the likelihood that people might be willing to come and willing to access our care. We also know that stigma leads to shame, which leads to isolation, which then leads to not accessing care, right? And I think everyone who is here is desiring to figure out ways to engage people who are pregnant into care who are using substances. And so, this is something that hopefully we can all kind of share and spread and get the word out about the impact of language, so that we can continue to provide services to people. So I really like this quote. It's by a group of actually dietitians and clinicians, therapists at a practice called Be Nourished. And so they don't work specifically with people who are pregnant using substances. However, I think this really applies to the work that we all do. So we would be better stewards of healing if we offered empathy for people's pain instead of shaming them, honored the wisdom in these methods of coping, provided opportunities for real connection, and helped create the space to develop other ways to cope. So I love this quote because it really acknowledges how much empathy and how far it goes to help people stay connected to care and help people share their stories and experiences, but also honoring the wisdom of these methods of coping, right? People who are pregnant using substances, people who are using substances, right, often use it as a way to cope with pain or with suffering of some sort, right? So we really want to honor these methods of coping. In many ways, they probably have worked for a period of time. They might even still be working, right? But really what's under that is providing opportunities for real connections, right? So that we can help create the space to develop other ways to cope, especially if that is what somebody is desiring and wanting. Okay, so we're going to move into motivational interviewing. And motivational interviewing is a technique that can be very helpful in working with people who are pregnant and using substances, people who are using substances, and it pairs really well with the harm reduction approach. Miller and Rolnick are kind of the leading folks on motivational interviewing, and have found it to be very effective in supporting people with any kind of change or any kind of change that they might want for themselves. So the spirit of motivational interviewing consists of 4 pieces: partnership, acceptance, compassion, and evocation. Right? So partnership is all about being for and with the person in collaboration. So partnership helps us build trust. The provider does not assume the expert role, and it's also based on mutual understanding, right? So some examples of what partnership might sound like if you're working with somebody. So it might sound like you asked about condoms, but I really want to know your thoughts first so that we can come up with the best plan for you, right? So if someone is talking about safer sex or ways to reduce harm to themselves or to their bodies, right? You asked me about ways to reduce harm, but I really want to know first what your thoughts are, right? We want to know first what the client or the patient or the participant experiences. And then we might ask them, you're responsible and you want to make sure you know how to keep yourself safe. Right. So that might be the response that we have when someone shares with us their thoughts. We want to encourage them and say, wow, you're really responsible and you really just want to make sure you know the best way to keep yourself safe. Acceptance. So acceptance is all about seeking and acknowledging somebody's strength and innate effort, right? We respect their autonomy. We provide empathy. We're affirming, right? We're affirming of the person, and client choice is emphasized. So this might sound like, what are your thoughts about taking your medication, right? The client might say, well, part of me really wants to, a part of me isn't sure. I don't know. There's some, I'm not sure yet. And so as a provider, we might say something like, well, you may not be ready to take them, but you're still thinking about it and you can take them anytime that you want, right? So that just sends a message of acceptance to the client. And then compassion. So compassion, actively supporting the well-being of another human being, another person. We focus on the client's need. We promote client welfare. And we demonstrate an understanding of their need, right? So an example of compassion might simply be, wow, it sounds like you have been through so much. It sounds like it's really been difficult for you. Just providing some compassion. And then evocation, right? Might sound like you have what you need and we will find it, right? So evocation is all about inviting the client's view rather than providing, right? Inviting their view, knowing and understanding what their barriers to change might be, right? Exploring ideas about possible solutions and eliciting some general insight about what change looks like for them. So an example of what that might sound like if we're working with a client or participant or patient, what would be the best result if you stopped using, right? What would be the best result if you stopped using, right? And so maybe the client shares a little bit and then we might say back, you sound like you know the positive impact of stopping to use, right? So using you statements can actually be really helpful, right? You statements might sound like, I'm here to hear what you want to change, or you know yourself best, or it's really up to you, or you know what works best in terms of taking your medication, right? So we want to put the client, the patient first. We want to partner with them, work to accept, find compassion, and evoke what it is that they are wanting. So it's the absolute value of the human being, acknowledging the value of the human being. And this also helps us build rapport, right? It helps us treat the individual as a person who is struggling, and it helps us elicit care. And we want to make sure that we're doing this genuinely, right? Again, so that's where kind of the checking in with our own stigma, our own implicit bias comes in, right? Because I think, you know, when we're in a relationship with people, we often can feel when they're not being fully genuine with us, right? And so we want to check in with ourselves and ask ourselves, okay, can I be genuinely engaged in allyship here? Right, as a way to increase willingness and a way to increase honesty and of course safety as well. So motivational interviewing in stages of change, Petroska and DiClemente, again, are kind of the founders of this, and why this is helpful. Because when we're working with people who are pregnant and using substances, or people who are using substances, we want to get to know kind of where they are in terms of their desire to change, right? Are they coming in to our clinic kind of ready to make change and ready to do something different? Is that what they're wanting? Or are we seeing clients or participants as we're doing street outreach and acknowledging that change isn't something that they've even thought about or even considered, right? So we want to make sure that we get to know where somebody is so that we can work with them in a way that would be most helpful for them. And so we'll go through these in a little bit more detail, but what I'd like to point out here is that at any point, right, somebody can start and leave at any of these stages, right? So somebody might start, you might see them and they might start in one particular phase. They might leave that phase. You'll see here it says relapse. We can also call it a slip. They might come back, let's say to your outreach vehicle, and they might be in pre-contemplation. So just know that that is normal. So to go into a little bit more depth, when we talk about pre-contemplation, right, think about a patient or a client or a participant that you work with who might really not be aware that any change needs to happen, right? So we want to really just provide compassion to this individual, right? If someone is actively using and let's say you work in a program where they're not, where abstinence is required, interventions and residential treatment probably won't work, right? Because the person is not at the point where they see that there is a reason or need to change, right? And so we want to be really mindful of that, especially you know, when we think about people going into treatment and then they leave, and that is where higher levels of overdose can happen as well for folks as they're coming out of treatment. So we really want to be mindful of that. We also want to check in and about the term and the label in denial, right? Someone is in denial that they need help or that they need to change, right? It's really just simply, you know, maybe not seeing what you see, that they are really struggling or that they are having a difficult time right now. Someone who is in active use might not be able to see, you know, what you might be able to see for that person in terms of imagining them in care and getting support and being in community, right? That sounds lovely and wonderful. But someone might not be able to see that if they're in their active use. Someone who's in contemplation might be ambivalent to change, right? Might say like, yes, but, and, right? And so this is a time where we actually can identify the benefits of substance use. This is often something that I've heard people say, you know, really, is it okay to talk about the benefits of substance use and drug use? Absolutely. What that does is just acknowledges, and we start to get to know the person as to why they're using. It might be for a variety of reasons. It might be trauma. It might be monetary reasons. We don't know, right? It might be to numb out feelings, right? It might be to disengage with their body or with their emotions. So when we understand the benefits and when we go through kind of the pros and cons, like what are the benefits of substance use? What would be the negatives of your substance use? It really allows the person to start to kind of understand that this is a safe place to talk about everything and to understand as a provider too, okay, if we can understand the benefits, we can then understand what it is that they, you know, some of the reasons why they might be using, and we can really begin to explore and start to work with someone to support them in some of those underlying issues too. So the next stages are preparation and action. So preparation is when someone might be at the stage where they want to do something to change their behaviors, right? So they might engage in, you know, methadone assistance therapies. They might start to map out ways to work towards their goals. They start to realize, okay, I think that I'm ready to start making a change here. And then action is when we engage in new behaviors, right? So new behaviors to continue to reduce risk. For somebody, let's say, who is an injection drug user, maybe if one of their actions is to snort instead of inject, because that is one way to reduce the harm to their body, right? And so we want to make sure that they're taking actions that feel right to them, right? And so again, an action, like we said earlier, might be a smaller step. It might be a step in a direction that just simply reduces the harm to themselves. They might begin to attend a recovery support group. They might even begin to engage in treatment. And then we have maintenance, right? So maintenance might be the phase where people are engaging in using Suboxone or methadone treatment. The sense of risk begins to fade here, and new needs actually might start to arise, right? So that might be the time, again, that somebody engages in community engagement. They might engage in ongoing therapy. They might feel more engaged, you know, in their methadone treatment. And remembering that, again, relapses or slips, however someone identifies, happens, right? So we have to take that into account, and it doesn't mean failure. It doesn't mean as a provider, anyone did anything wrong, right? We just have to recognize that slips are part of the process. It's all part of the process. So it's a time to reflect. It's a time to get curious, right? If someone is maybe they used more than they intended to use, right? And we want to take risks, take slips into account. Because like I said earlier, if someone hasn't been using for a while and they start to use again, the risk of overdose increases. So we want a safety plan. We want to provide reflection and a compassionate space to explore. So we do this by listening, right? We do this by listening. And again, if you'd like to close your eyes, you're welcome to do so. I'm going to just read these two quotes. The first one by Carl Rogers. We think we listen, but rarely do we listen with real understanding, true empathy. Yet listening of this very special kind is one of the most potent forces for change that I know. And another quote by Brenda Euland. Listening is a magnetic and strange thing, a creative force. When we are listened to, it creates us, makes us unfold and expand. Ideas actually begin to grow within us and come to life. When we listen to people, there is an alternating current, and this recharges us so that we never get tired of each other. And it is this little creative fountain inside us that begins to spring and cast up new thoughts and unexpected laughter and wisdom. Well, it is when people really listen to us with quiet, fascinated attention that the little fountain begins to work again, to accelerate in the most surprising way. So I really love these quotes because the value of listening and the importance of listening and truly listening can create so much connection, can create such a safe space for people to come and access services and to access you. And so how do we do that, right? Active listening actually is a skill. It's hard. It's not something that just comes easy, right? And so I just want to acknowledge that listening actively is a skill that we can certainly build on and that we can certainly practice, right? So active listening skills using OARS, and OARS is another motivational interviewing technique that I find to be really helpful in helping us just not only actively listen, but to be present with another human being. So OARS, it helps build trust with the individual. It helps to create an open dialogue, right, to engage in their story. And it displays interest and the struggle with behavior change, right? So again, to kind of tie it all together, right? When we use a harm reduction approach, we are with somebody non-judgmentally, empathetically, meeting somebody where they are at, in whatever stage of use, in whatever level of change they're at, right? And to be able to be with them, to be able to engage and be with them in their story, just creates a strong sense of trust, right? And if we can display that we are interested in their struggle and that we are interested in hearing and understanding that behavior change is hard, right? I think we can, myself included, can relate to trying to start a new habit, right? Or just trying to do anything a little bit differently. It can be really difficult. Right? So we just want to acknowledge that. And so the way we do that is through open-ended questions. And we'll go through these in more depth as well. We affirm, we reflect, and we summarize. And when we do this, we also want to pay attention to any kind of change talk, right? And we want to really kind of grab onto that and and utilize when someone is beginning to have some change talk, because then we can really build on that experience for that person to help build them up too. So open-ended questions, right? Again, I come back to this often, but asking from a place of curiosity, of non-judgment, right? So that might sound like, I hear that you're struggling to make your appointments and that you really want to make them. Help me understand, what are the barriers, or what's making it hard to come to your appointment, right? Rather than saying something like, you're not making your appointments, this is a problem. I don't know that we can keep seeing you anymore if you're not making them, right? And what that can do is shut people out. It can shut people down, right? Again, noticing we might have feelings inside of like, oh, I wish this person would just be able to come to their appointments. It's so frustrating. We really can support them. So we want to check in with ourselves when we're asking these questions, right? We want to be inviting in our tone. We want to find empathy in the other person's experience. And so some prompts can include, you know, tell me about this struggle. Tell me about, you know, what's making it hard, or tell me about what's making it hard to access your methadone treatment, or tell me about this experience. I want to know more. Or how, right? It could be something like, how are you feeling today, right? Or what else? What else? Tell me more. So the invitation, right, is to put words to their experiences, their emotions, their thoughts, their fears, and their ambivalence. Next, we want to affirm, right? I also added affirmations here too. Affirm or offer affirmations. So we want to validate the person's experience. We want to validate their experience. Support any positive change, even if it, in our mind, might be the littlest seed of positive change. We really just want to support them, help build the person up. We want to acknowledge any past or current life stressors while utilizing strength-based approaches. So something like that, if somebody has continually, let's say, missed their appointments, struggle to show up, we might say something like, wow, it took a lot of courage for you to show up today, right? Something that comes to mind for me in working with folks that use substances, being on Zoom or even in person, right? Providing services either in person or even on Zoom. I have participants that come and they have been either drinking or using before a session or the night before. And I have choice there, right? I could say, you know, I don't know that we're really going to get a lot of work done here. Maybe we should cancel today's session. Or I can say, wow, it really took a lot of courage for you to show up today, even though you've been drinking or even though you have been using, right? And what I have found to be very helpful in that is that people then know that it's okay to show up, right? To show up just as they are. You know, the work might look different that day. It might be more about safety planning. You know, we might not go as depth into the work together that day, but we want to acknowledge that they still showed up. There was a reason why they still wanted to show up and seek support. Or I appreciate you taking the time to share your story with me, right? Sometimes that can also take a lot of courage. Or wow, you've accomplished a lot in your life already. Or you're really working hard despite so many barriers. You're really working hard. Especially, you know, that could come up if someone is struggling to get to appointments or, right, to access care. Right? You're really working hard, even though there's so many barriers. And then reflective listening. So we want to check in with people rather than have our own assumption about what somebody might be experiencing or what they might be feeling. right? This helps us display a sense of interest, of curiosity. So some prompts might sound like, it sounds like you're having a really hard time today. It sounds like getting to these appointments and finding transportation has been a huge barrier for you, right? Or what I'm hearing is, or sort of like, or even a statement, right? You're feeling scared, right? When someone just acknowledges what we might be feeling, it really can help the person soften, right? You're feeling scared. You're wondering if, fill in the blank here. You're wondering if things will ever change. You're wondering if we can help you. You're wondering if, or you're not sure if. You're not sure if we'll be able to help you, right? You're not sure if you can trust me right now. You're not sure. So again, what reflective listening does is just validates the person and lets them know that you see them, you hear them, you're with them. And what that can do, I mean, think about it for ourselves, right? When we know that someone is just here with us in our experiences, it really can soften us and begin to acknowledge for ourselves and for others that this is a safe place, that there is room, to be you and all parts of you here. And so summarizing, right? So summarizing is about kind of reinforcing the discussion, right? Identifying any change talk or ambivalence to change. And so some prompts might include, so let me know if I'm hearing you right. I want to make sure that I heard it right. Or I hear you saying there's a part of you that wants to change, or there's a part of you that wants to access treatment. There's a part of you that doesn't. Did I miss anything? Or let me make sure that I've understood everything that you shared with me, right? Or, so what you're saying is, did I get that correct? And what these kind of summarizing questions offer is a space to clarify anything that you may have missed, or a space for the participant or the client or the patient to, first of all, to know that they've been heard, but also know that if something was misunderstood, then there's a space to talk more about it and to help you understand as the provider. And so we're now going to talk about some engagement strategies that we can use in order to support people in care, in order to support people, hopefully, to stay in care. I know that that's a big barrier, is getting people to stay in care, getting people access to care. And so hopefully some of these strategies you can use to help engage along with the OR skills and the motivational interviewing skills and the harm reduction modality too. So we'll go into more details about this as well. But first we want to engage, right? So in engaging, we want to help the client identify their goals, right? And goals can be on a continuum using harm reduction strategies, right? So again, we want to keep a wide net of change. Change can be on a continuum. It might not be stopping the substance use, right? It might be reducing. And again, keys to this are building rapport, a sense of safety, and empathy. We want to focus, right? So we want to focus on what the target behaviors are. We want to identify ways to move into safer use or positive behavior change. And this increases the likelihood of somebody staying in treatment. And we want to evoke change talk, right? So we want to get curious about their desire for motivation. And then we can help prepare and mobilize change. And then plan how change will happen. So engaging, right? Think about the engaging process as like the hello, the hi, how are you? Nice to meet you. Glad you came in. It's all about building rapport, using those active listening skills, staying curious and open. So the goals of this process is comfort, is safety, is empathy, and is building a relationship. We then want to connect to the focus, right? So what is this person desiring? What is their direction? What is their goal, right? So we want to explore what their target behavior is, right? Is it accessing care? Is it transportation? Is it aftercare? Is it accessing methadone therapy? Is it, right? We want to know what their goal is. What is their desire? Is it accessing child care services? Is it accessing food services, right? So we want to explore their ambivalence, explore barriers, and ask yourself, is this my goal or is this the client's goal, right? It's easy to get caught up into a place of, oh, I really want this client to stop using, or I really want this client to come to appointments. Right? We want to check in. What are the client's goals? Is it to access safe housing? Is it to get out of an unhealthy relationship? Right? And then why? Right? We want to understand, okay, why are they wanting this goal? We want to understand and help build the client's own internal motivation for change. Right? So we want to elicit and reinforce change talk, and any movement towards change is fantastic, right? So what is their desire to change? What is their ability, right? Are there barriers to making these changes in their lives? And what's the reason? Why do they want to make this change, right? What would the benefits be for them? And what is the need? What is their need around change? We want to increase the amount and strength of change talk, right? And so we do that just by getting curious about their motivation and help them develop their own internal sense of motivation. So the plan is how, right? So the plan is developing a specific plan of action. And this is only if the client has developed a commitment to change, right? And so some of the goals might be developing skills. It might be action planning, right? Which might look like getting them connected to community support services. It might mean removing barriers to change. And if there's outside support, finding ways to connect to outside support or increasing outside support. And in this, we really want to, include the client or patient or participant in this process, right? So it might be asking like, well, what are your ideas about how to engage in some outside support? What is it that you are looking for, or what would be helpful for you in terms of, accessing care? We want the participant to really engage in some of the solution exploration. And so when do we plan? Again, when there is significant engagement and there's a clear shared change goal and there's sufficient client motivation to change, right? We want to set people up for success, right? And so we want to work with in this stage, supporting people if they are in this stage of change, if they are ready to plan. We want to support them and we want to set them up for success. So we want to try using a summary when moving from evoking to planning, right? And so that might sound like, exploring what was just talked about, And then again, talking about, okay, what is it that you are needing right now in order to achieve this goal. Okay. And then we also want to make sure that we are bringing compassion towards both ourselves and towards others. So this work is not easy, right? This work can be very rewarding and it can also be very challenging. So self-compassion can be such a helpful tool, not just when we're working with people, but even when we are not in the office or when we're not doing outreach or wherever your setting may be, right? Self-compassion is a way to bring some ease towards yourself and a way to offer that towards others. So self-compassion includes kindness, includes mindfulness, and common humanity, right? So kindness towards oneself, kindness towards others, which includes the non-judgmental approach. It includes empathy. It includes curiosity. Mindfulness, right? Mindfulness of our own stigma, mindfulness of our own biases, mindfulness of how we're showing up when we work with people. And then common humanity, right? Common humanity is this idea that we are not alone in our experiences, right? That other people feel, other people experience these experiences as well, right? So whether that's considering your own experience of struggle or your own experience of stress or burnout or overwhelm, or maybe your own history of substance use, your own experience facing barriers to care, right? Your own experience in addiction, or other people's, right? Other people's experience in their own struggle too, right? So reminding yourself and reminding others that you are not alone, that they are not alone. Kristen Neff, who's local here in Austin, has a wonderful website, selfcompassion.org, where you actually can access many meditation practices that can be actually very helpful for the people that you work with, can be very helpful for yourself, as a way to even help yourself and the people that you work with sustain the work and also find some kindness towards themselves. So these three kind of statements really can be used at any time. May you be safe. May you feel at ease. May you find peace. Right? So sending to others. May I be safe. May I feel at ease. And may I find peace. Right? And may we be safe. May we be at ease. May we find peace. Right? So I share this with you because, you know, again, in this work, you can use this, again, when you're meeting with somebody, you can use this as kind of words or a little meditation practice for yourself. It can invite community, it can invite connection, it can invite empathy. And I just also really love the work of Kristen Neff and mindfulness practices. So I just wanted to share some of that with you all today as well. And I love this quote by Johann Hari: the opposite of addiction, and I'm going to add, is actually not sobriety, but is connection. And Johann Hari has a wonderful TED Talk. Some of you may be familiar with it. That talks about this concept of connection as a way to support people who are pregnant, to support substance users in their struggles and in their experiences. And so, you know, I share this quote with you all today because it has very much been a powerful tool in working with people struggling with substance use. Because again, what we've talked about today and what we've began to explore today is that sometimes what it takes is just simply being present with somebody else, listening, being empathetic, being a welcoming and safe person that somebody can go to so that they can start to feel comfortable expressing their experiences, expressing their stories, right? And even recognizing that somebody cares about them, right? I know that I've worked with folks when I did both in private practice, but also doing outreach work when I was living in New York City on a syringe exchange van, and working with people who just want to come and talk and know that they are safe, know that they are welcomed with all parts of them. And when we did that, it was such a powerful tool to engage people in care, right? They would keep coming to us. They would access services. Over time, people would then access healthcare and medical care and even mental health care, right? But there's this simple concept of connection, right? Being that safe person can really open the door for people to recognize, that people care about them and want them to be safe and healthy in their lives. So some key takeaways that I just want to offer from this presentation is that harm reduction is a modality that supports a non-judgmental person-first approach to support engagement. And if you're looking for more resources around harm reduction, the National Coalition of Harm Reduction, the National Coalition of Harm Reduction is a great resource. They're based both in New York and in California, and they have a plethora of trainings that you can access on their website. It's a great resource if you're curious to know even more and to go deeper into harm reduction. Another key takeaway is checking in with our own biases and our own stigma about people who are pregnant and use drugs. And again, if we can stay curious about it, if we can acknowledge that bias exists because it is historical, right? Stigma exists because it's historical stigma, right? Based on our systems, based on our the systems and the structures that we live in and work in, right? So it takes work to try to undo some of those biases and stigma. So really being caring and compassionate to yourself as you practice undoing and unlearning and relearning. Motivational interviewing can support change in an empathetic and caring way. So again, motivational interviewing can help kind of understand where people are at so that we can meet them where they're at in wherever they are along their continuum or desire for change. And then by using listening and engagement skills, using OARs and engagement strategies can help people hopefully stay connected to care, to access services. And then again, finding compassion towards ourselves and towards others in this process. Right? People oftentimes who, and I'm sure many of you know this, right, who are pregnant and using substances probably were using before they became pregnant, probably are wanting the best for their child, probably wanting the best for themselves, right? But they are struggling. They might be struggling, right? So we just want to find compassion towards other people, and then bringing that compassion towards yourself to just help reduce burnout, to help reduce fatigue, can be really helpful tools in continuing to do this important work. All right, so here is my email information. Welcome to email me with questions or thoughts. I know we're gonna pause here and have some time for questions and discussion here, but I just wanna thank all of you for showing up today, for being open to learning about harm reduction. So I'm gonna stop sharing my screen now. Okay, all right. So there's a question if you can get a copy of the PowerPoint, and I believe the PowerPoint will be available.
It's already in the course. It's already in the
Great,
Canvas course. I loaded it a couple
great.
days ago.
Okay, wonderful.
Oh, somebody says their legal name is Neerthi Falchuk. Somebody might be related to you.
Ah, yes.
Somebody had a comment earlier. Let me see if I can find it. Oh, it said, I had a client who called the drug use a condition. She was using oxycodone for injury from an accident. So she called it a condition.
Yeah, I mean, that's, again, I think what I would get curious about is what that means for the person. What does it mean that it's a condition? You know, it sounds like they became addicted, yeah, because they were prescribed medication, and it started to become addictive for them. And so I would get curious about what that means for them. What it means that it's a condition. Is it something that they're struggling with? Is it um, right? And it's interesting that they let you know that they called it a condition, because I'd be curious about maybe some of the internal stigma that that person has about people who use substances, right? Just something to kind of take note of, like, okay, if it's a condition, um, you know, what are some of the assumptions that this person might have, you know, just around substance use, and around addiction. So just kind of a place to get curious about that, maybe even just for yourself as a provider, and then trying to understand what does it mean by they have a condition, and welcoming that exploration. So, good question.
Oh, here we go. The one person's commenting, I took a bias test in one of my classes at school and I got surprised about the implicit bias I have.
Yeah. Yeah, thank you for sharing that. It is surprising, right? It is very surprising, how much our own bias just kind of starts to become, um, you know, like who we are. We don't even really think about it unless we actually give space and time to really notice it and explore it. Um, we all have bias, right? Myself included. And so it's very interesting to yeah, to just take note of that and recognize that it's there. And it doesn't mean that you're bad or that you're doing anything wrong. It means that you're a human being living in our culture and society, that is full of bias. And so the work is to unlearn. But the work first is to do what you just did, was to take the test and acknowledge it, acknowledge that there's bias there, so that change and shift can happen.
We have another comment. I love this presentation, being someone who had a firsthand experience with stigma and judgment as a previous pregnant substance user. Your last statement of the client still loves and wants the best for the child is absolutely true for my case. My question is, are there any CPS workers who come to your training?
Mm. Thank you so much for sharing that. I really appreciate hearing from you. Um, I I don't know if there are any CPS workers here. That's a great question. Um, I think it would be a great training if there are CPS workers here, or for future trainings. Um, because I mean and I think there's some trainings and talks at this conference this year talking about CPS. So that hopefully that will be a space to ask more questions around that. But yeah, there's a lot of work I think that could be done around CPS. But substance use alone, somebody who is pregnant and is using does not necessarily mean that a CPS report needs to be made. And again, I'm sure the trainings that are coming up with specifically around CPS will go more in depth around that. What's most important is just making sure that safety is there. So yeah, thank you for sharing your story, and I hope you feel heard and seen in this space today.
We have another comment. I just wanted to say that I really liked the part that talked about being judgmental because we are human. I know in my field, some of the stories are tough, but we are all here to help support our clients in their journey.
Yes, absolutely. And thank you for just acknowledging the humanness of judgment, right? You are absolutely right. It is a human experience to have judgment, to notice judgment. And there's so much space to even just acknowledge that, right? If you could acknowledge it in your workplace with your colleagues, right? And talk about when you notice that judgment arised. And if there's room to create a culture that it's okay to talk about when our own judgment and bias arises, because the more that we can talk about it, and the more that we can make space for it, the more, like you said, we can be here to help support our clients in their journey. So yes, great acknowledgement there. Thank you.
How would you handle someone coming into their appointment while currently high?
That's a good question. So the way that I handle it is I see them. I see the person. So right now, because I'm doing everything over Zoom, I don't need to worry about the person driving home or wherever they are from their appointment, right? So the primary piece is around safety, wanting to make sure that the person is safe, wanting to make sure that if they are planning to drive, that they don't, and that we ensure that they have a ride home. And also recognizing that, the work might look different when someone comes in to a session or to an appointment high, right? And so my expectations might need to shift a little bit, but also recognizing that just because someone comes in high doesn't mean that we have to end the appointment or that nothing can get done, right? It actually can be a really helpful time to check in and understand, what the triggers were to coming to this session high. It's also important if you work at an agency or in a larger organization, understanding what the policies are in your particular organization, and getting curious. So if the policy is, that we don't see clients or participants who are actively using substances or coming in on substances, maybe you just get curious about that. Where did this policy come from? Who is it benefiting? Is this a policy that can be shifted or changed if you find that it actually is not helpful? So, and then there's a lot of space, for the next session when somebody comes in to explore how that was for them. What was it like coming to session? Having used a substance, what prompted them to do that, and there's so much more richness that can come from that. And we also want to recognize the value of somebody coming in having used is a very vulnerable, or can be a very vulnerable experience. So we want to acknowledge, wow, again, that must have taken a lot of courage, I can only imagine, to show up hi, is that true for you? How was that for you? So it can be a very rich discussion, and can continue to build the relationship and the rapport with the person that you're working with. Thanks for that question.
Any more questions, please put them in the chat. Okay, I think we're winding down. Everybody's saying thank you, great presentation. So you can give your final thoughts.
Yeah, so thank you everyone for showing up today and just for being open. You know, if this is new information for you, and you're still processing it, and that is okay. That makes a lot of sense. So just know that you know, it's okay if you're having lots of thoughts and feelings and more questions and more questions, and it makes a lot of sense. So I encourage you to just stay curious. And again, just thank you all for showing up and coming and being open to this approach to working with people. Thank you for all that each of you do, and for this conference as well.
And the evaluation is available in your Canvas account. So it opens up at 12:30. So if you are wanting to give feedback on the presentation and get your CE certificate, please make sure you log into your Canvas account. Everybody have a wonderful day.
Take care.